Hello everyone, welcome to the workshop, the Health Literacy Workshop. My name is Ankita Gupta and I'm the Director of Performance Improvement. So let's talk about the key areas of concern. The key areas of concern that I have chosen to talk about is communicate clearly with patients, help patients to remember how and when to take their medicine, encourage patients to ask questions, and these are concerns because of patients' healthcare needs. And if there is any lack of communication, then it leads to misinformation and misunderstanding. Patients who are not abiding by medications, for them it may lead to further health complications. This is because if the patient does not take the medication, then which is there to improve their health, it may prolong treatment, and something more bad can happen to the health, and which might um, and have them um, result at the hospital. And that's why abiding reduces the rate of hospitalization, which also helps in improving the health of the patient and also helps reduce healthcare costs, because uh, going to the hospital and having more expenses for further treatment can all be avoided if medications are taken by the patients on time to prevent further health treatment delays and from the health from worsening. And it is important for providers to encourage asking questions. It helps uh, for the patients to understand whether their understanding is correct or not, and helps the provider understand how much they have been successful in communicating what the patient needs to know from their side. And it also opens the field of patient-provider trust. The patient-provider trust uh, results from when the physician or the health provider makes an effort to allow the patient to ask questions, makes the patient they take the time to learn if the patient has understood, and giving them time to openly talk to the provider without a fear of being judged. So why are they important? Why are these issues important? The definition of health literacy addressed in the United States. So let's talk about that. The definition goes by the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Continuing, the patient-provider face-to-face interaction, and it helps in understanding information better. So why is health literacy important now? So um, patients need to understand health information quickly because they have a limited time face to face with the provider. This includes brief office appointments and short hospitalizations, as quoted from the book um, of health literacy by Osborne. And patients' medication reminders ensures consistency. So maybe calling, making a phone call to the patient, reminding them of the consistency can be done either by calling them or through text. Mobile application is now readily in use. So using that method, if the patient is able to have even a limited access to technology through phone, then that is one way to communicate and get in touch with the patient, reminding them of the medication. and it helps encourage healthier lifestyle. And the patients, one thing I might want to add is patients, along with their family members and their caregivers, are expected to correctly accomplish a wide array of health-related tasks. These tasks may be complex and unfamiliar, such as using new types of technology or taking medication on time-sensitive schedule. So, if the patient has any kind of language barriers, or the patient have any, they are not so literate, then they may have family members who can help support the patient's knowledge and communicate to the patient for the provider. And so this ensures that it is a collective team effort from both the support of the family and the provider themselves. And the communication is open and effective. This is important because through communication, it broadens understanding of both the provider and the patient, how much they can support the needs of the patient, learning what the patient needs. So miscommunications can also lead to further complications. Patients, it's important for the patient to be active listeners. This includes um, reading information given to them by providers, as well as assessing the credibility, relevance of health information from family, friends, and popular media and the internet. As we learned this, and patients are increasingly seen as active consumers rather than passive recipients of treatment and care. Patients today are often asked to make key health decisions and expected to advocate on their behalf. In this scenario, if there miscommunications arises, where the patients are having to speak to the provider uh, in their support of what may be going on in their health, what the provider needs to know about them, that is important. And therefore, it is essential that the least amount of miscommunication happens, and more active understanding of each other increases with patient and provider. And if, for example, if medicinal dosage if incorrect, can be dangerous. So communicating the right amount of medicinal dose, how much to take it, when to take it, is essential. So my definition of health literacy that I came up with is health literacy. To put it in simple words, is learning, understanding health information in a way that helps develop the knowledge needed for patients to have the ability to make informed decisions for themselves and their families. For providers, learning the background of the patients and asking questions to the patient, encouraging patient questions, eliminates misunderstanding and misconception, which may lead to serious preventable recuperations. Sensitive to patient culture and learning disabilities forms a healthy relation between patient and provider. It is very essential that the provider takes the time to understand where the patient is coming from, what background they are coming from, because only then the provider would be able to cater their need to the patient, so that there is a bond of trust and understanding, which will help develop better relations with the patient and provider, and also support providing the best care to the patient by the provider. So next is the key communication principle. In this, I'll be talking about a program that is nationally uh, available. It's called National Action Plan to Improve Health Literacy. There are 7 goals to it, and I've just mentioned a few in here. That says, one is develop and disseminate health and safety information that is accurate, accessible, and actionable. and promote changes in the healthcare system that improve health information, communication, informed decision making, and access to health services. Incorporate accurate, standard-based, and developmentally appropriate health and science information and curricula in child care and education through the university level. Support and expand local efforts to provide adult education, English language instruction, and culturally and linguistically appropriate health information services in the community. It helps in building partnerships, develop guidance, and change policies, increase basic research and development, implementation, and evaluation of practices and interventions to improve health literacy, increase the dissemination and use of evidence-based health literacy practice and intervention. So the key principle that um, employed to address this issue is basically communication. And the method that are aligned to work with is working together in the community. So what recommendations do we have? And with healthcare, what can help providers avoid? They can avoid jargon, talking too fast, not asking questions, uncommon words, abbreviations. Jargon include when a patient, I'm sorry, the provider uses medical terminology that they are familiar with their colleagues, and they communicate through that language of understanding of the health needs or health topic that they are working on or assessing. However, the patient may not understand it, may not be familiar with them, or have a medical background. So that is something that the provider needs to be mindful about, and not and that they are using plain language to communicate. They should not talk too fast, as that takes away time from the patient to communicate. And it should be 50-50 balance, like 50% the patient, the provider talking, and 50% the, the patient is talking, not 70-50. 70% the provider talking and 20%, 30% the patient. So alternatives is talk in a slower pace, use plain language, provide pictures, ask question, and use talkback method. Use, which I'll explain in a little bit. Use common words. Be culturally sensitive, and check for language barriers. Pay attention to non-verbal language, check for any distress. Talk enough for the patient to understand, keeping ethics in mind, culture, background, literacy level, and views regarding healthcare routine size of difficulty. So let's do a small exercise. So small group exercise build your role play. So there will be a total of 8 groups. We will split them into 3 groups, and there will be one health provider in each group. Patients will be 2 patients in one group. There will be 1 patient in group 2, 2 patients in group 3. So now the role players playing the providers. It's important for them to ask open-ended questions. So observe. So the duty of the provider in this group exercise would be to observe the body language of the patient, look for clues of understanding and lack of comprehension. For example, looking lost, nodding their head without understanding. You can tell by just looking at their eye. They're just staring out in space. And it's important they can learn about the background to be more culturally sensitive. They can use teach back or show me method to check their understanding. I will be explaining what that means in a little bit, as I mentioned. So the time for each group is 15 minutes. The patient needs to listen, ask questions, observe the provider, take note, and evaluate if are they being helpful, understandable, communicative, empathic. Repeat questions asked. Check your understanding. Think of questions, ways the provider can improve. Group 3 patients look lost and not be able to comprehend, and the provider will take note of it. to determine what was missing and other things. Communication is key to learning and understanding. So the areas of concern is lack of understanding for patients, providers unable to recognize clues of literacy issues, frustration for the patient, unable to communicate effectively, patients feeling unheard, providers talking too fast, too many information, lack of visual representation from providers to enhance learning, no teachback method or show me to assess patient understanding. The materials that we'll be needing is both audio and visual communication, whiteboard, writing pads, pens, write down the questions and have patients read them, providers. That's for you. Observation and language. Ask the patient language that they are comfortable in. Posters, which pictures of topic discussed. Visual representation of communication by providers through charts, pictures, why medication is important, providing pictures and showing the effects of not taking the medication and effects of taking the medication. So a pro and con, a visual representation for the patient to have a better understanding of what they need to do and why. Look for loopholes, distractions, excuses, forgot glasses, and to 3 rooms, one note take of the meeting. So details. Each group will be in separate rooms, act as a real setting. Provider will ask the question, asked about the background, communicate in simple language. Patient will answer the question, ask questions when they can't understand. Teachback method use that provider will observe a patient and will check what they understand. 15 minutes for each group. The teachback method is when the provider introduces or explains new information to the patient. The patient then repeats back in their own words, own perception of the shared information, and repeat demonstrated applicable. Provided and assesses repeated information for accuracy, information gaps, and then provider adapts messaging based on assessment. So provider will provide information, the patient will relay it back to the provider, and then the provider will determine if what was said to them is what they intended, and what the patient understood is what the provider intended them to understand. If not, then the provider re-says what they meant to say and explains it in a more simplified way. And then once the patient provider and patient are comfortable with patient comprehension, retention and competency, then you can move forward in telling them exactly what they need to do, and they make follow-up appointments accordingly. The expectations. The providers is be friendly, approachable, and easy to communicate with patients, be active listeners, and see how well you understand the provider. Goal is to achieve success in communicating simple language by providers. Visual representation of the communication enhances patient learning. Teachback methods apply or show me method. Patients repeat what the providers say in simple words. Providers check for patient understanding. Providers ask open-ended questions. What questions do you have? Not a yes or no question. So you have to ask more. Uh, how well? Tell me what you understood, or how can we help you better, or what else do I need to know from you? That will clear my understanding of what you may be going through. Not are you happy with what been told to you, or are you happy with the service? So those are yes or no questions, so those should be avoided. The anticipated result. Providers use simple language to communicate, educate themselves on patient background, especially new patients. Listen, observe the patient attention, look for excuses, look for any excuses that the patient may be making. So that's a red flag. And have patient teach you back what they learned. Patient check if the patient have understood well. With visual, patient learning increases. Form strong provider-patient relations. Empathic approach helps in developing patient trust. Thank you for your time. I hope this session workshop was helpful. And if you have any questions, please let me know. I enjoyed presenting this piece to you. Thank you.